We've had an awareness of concussion for a number of years, but over the past few years, our understanding of concussion and their impact on athletes, both on the field and in the classroom, has increased dramatically. Condell has developed a program to try to better identify when concussions are occurring and work with both the student and their families to help them get back to normal life, be it on the field or in the classroom. When we talk about a concussion, it's something called a functional injury. When there's a blow to the head or to the body where the energy comes up to the head, there are functional changes that occur in the brain. The brain needs a period of time to correct those changes, and under most circumstances, things do return to normal over time. However, if a second injury is sustained prior to the first injury fully healing, the outcomes can become more complicated. So we try to avoid that by identifying when a concussion has occurred, removing the person from an environment where they can get re-injured so the brain has time to heal. With a concussion, it's not uncommon to see emotional changes either immediately or sometime after the injury. These most commonly include depression, anxiety, or mild personality changes such as irritability. These do tend to resolve with time, oftentimes quickly, but can be scary for families as one of the initial presenting symptoms. If a student or athlete is concerned that they've sustained a concussion, they should go immediately to the athletic trainer if one is available. If not, they should seek help from the school nurse or a teacher right away. Neuropsychological testing or neuropsychology is the study of brain-behavior relationships. So it's working with individuals that have changes in how their brain's functioning, either from developmental causes, injury, or disease. What we do with neuropsychological testing is specifically look at a person's different thinking abilities. We take them through measures that will look at things such as their attention, memory, language skills, reasoning, to give us an understanding of how a known disease process or injury might be affecting their thinking, or to help with diagnostic clarification. Impact testing is something called a cognitive test. It looks at the person's thinking abilities. So it's a computer-based measure that takes a few minutes to administer that looks at their different thinking abilities like their attention, processing speed, and memory. The purpose of Impact is to do a baseline testing to get an idea of what a person's thinking abilities look like before they're injured. Everyone's thinking abilities are different. We're all individuals. So if we have a sense of what a person looks like before injury, we can then repeat the test afterwards if we need to for comparison purposes. Concussions are a scary injury, and we certainly hear a lot about it in the media. The important thing to realize is that concussions are generally a self-resolving injury, which means that everyone goes back to normal over time. It's certainly important to manage symptoms, especially when we're in the early or acute stages, but we need to have an awareness that there aren't typically long-term ramifications from this kind of injury.